everyone. Welcome to episode 3, ready and starting a new year with the Soapbox. Today we have Dr. Grant Miller. Welcome to our podcast.
Thank you for having me.
Of course. So before we get started and do a deep dive, we're going to be introducing Dr. Grant Miller today. He is a wonderful veterinarian, quite the rising star in California here. He got his Bachelor's of Science and his Doctor of Veterinary Medicine degree here at UC Davis. He is the class of 2004, correct, for the DVM class?
Correct.
And he recently received the 2023 Alumni Achievement Award. It is considered to be one of the highest awards that you can achieve as an alumnus here at UC Davis. He's done incredible work across California and the nation for equine welfare, particularly in equine abuse cases, forensic investigations, and also just preparedness and response for animal care plans in terms of natural disasters. He is currently the Director of Regulatory Affairs here at CVMA, which is the California Veterinary Medical Association, and he was the first CVMA intern ever. Is that correct?
That is correct.
Perfect.
Yep.
Wonderful.
Yep.
So before we get into more of the deeper questions, we have an icebreaker for you.
All right.
So obviously you do a lot of politics, public policy, whatnot. If animals could vote, which species do you think would campaign the hardest for better veterinary policies, and what would their slogan be?
Wow, boy, that's a good one. So if they could vote, I would bet that cats would campaign the hardest.
Mm-hmm.
My guess is that cats would campaign the hardest. And of course, I'm a little bit biased because I am a cat person.
Okay.
So actually,
sense.
my only pet at home is a cat. So and he, rules the roost.
Mm-hmm.
I think their slogan would probably be "Pets are people too." And honestly, from a public policy standpoint, that's really where I am definitely seeing our world going, in
Mhm.
recognizing that pets are part of the family, and that means that we are the other family doctor.
Wow.
Yeah.
Great answer.
Hey, icebreaker for you.
Of course.
So this is something that you might not be able to answer right away, but it's something that I've given a lot of thought to in thinking about the intersection of One Health and public policy. What is it about the veterinary profession that makes it the best profession for you? Because clearly you could probably have gone to law school, medical school, probably had your pick if you got in here.
Yeah.
What is it about veterinary medicine that drew you to it? And maybe, dare I say, your classmates, your colleagues, what is it about this profession that makes it in our eyes better than every other profession?
That's like a whole interview in itself, but yeah, I'll try to answer to the best of my ability. I think for me, what drew me to veterinary medicine was its flexibility, and also it allows a lot of future veterinarians to think to the future in not like a focused manner. And what I mean by that is, I think that for myself, I was always struggling with different career paths because it seemed sort of set. If I took the MCAT and I went the med school route, I knew I would have to choose a residency path down the road, and that would be the future for me. I know that if I am a lawyer, as you mentioned, I would probably have to be specializing in some sort of sector so that I can help out my community in that way, and stick to that. I think for veterinary medicine, quite frankly, I still don't really know what I want to do as a veterinarian, but I think a lot of our faculty members, a lot of our students that I'm talking to, a lot of people are interested in seeing where different fields are intersecting and going together. And this is why I joined the Students for One Health Club, because everyone has so many different passions and interests, and they always work together with different sectors, different communities. And I think that's something that I'm looking for. So I know that despite whatever I decide to do, whether that's wildlife or surgery or whatnot, I know that as a veterinarian, I will not only be working with animals, despite the contrary for what a lot of people think. You have to work with a lot of people. You have to work with people from the public health section. You have to work with medical professionals, policymakers. So that's something that I really want to hone in on, and I'm looking forward to the future already in terms of that.
Hey, I love that answer.
Yeah.
And I think it's actually, we're going to touch again on those themes throughout our talk today, because I actually feel largely the same way. And it's great to hear you actually say that and understand that level of what this profession can give to people who work in it at this stage. So,
Yeah.
and you're exactly where you're supposed to be. If you're not quite sure what you want to do yet, that's the right place at this point. And look at me. I mean, my career has taken turn after turn after turn, and I've learned to really love that and enjoy what comes next. And there's always that little feeling of trepidation, but overall it's been a great ride for me so far. So
looking forward to it already. Yeah, what a great question. Thank you so much.
Sure. Yep.
Of course. So we'll get into our first question. So we've kind of introduced what CVMA is. I think a lot of veterinary students in particular know what it is, but it's kind of like this enigmatic organization that we're all a part of. We kind of get into it as a first year. But in terms of, do you mind expanding on some of the roles of what CVMA does in terms of continuing education credits, student benefits, business support, etc.?
Sure.
Yeah.
So, and thank you for delineating the CVMA, because it gets difficult when you're here in school and you hear about all these acronyms of the CVMB, the CVMA, the AVMA, all these different organizations. And while they all have a distinct and important role, the CVMA, in at least in my mind, is one of the ones that can most heavily impact your day-to-day life if you practice here in California. So we've been around since 1888.
Not 1918.
So 137 years the CVMA has been around. And in the beginning, when the CVMA started, it was actually there to not only create best practices for how medicine is practiced, but to also sanction veterinarians who were not practicing in accordance with the status quo. So back before the Veterinary Medical Board was created through our government, the CVMA was actually responsible for policing the profession. And then as the government started to wrap its arms around that regulation, the CVMA, augmented that role by doing things like you've mentioned, which include continuing education, and then largely political advocacy. So I guess the more fun part of what we do is continuing education. So as veterinarians and registered veterinary technicians, we're required as a condition of our licensure to take classes each year to make sure that we're continuing to stay current. We offer a lot of those classes. And we take what's best in California, the Monterey coastline, San Francisco, Lake Tahoe, Palm Springs, and we move our conferences around so that everyone in the state has a chance to come to a relatively local conference and get some good CE. That's the fun part. The tougher part about what we do is politics. And the challenge there is that if we were not here, there would be no one to duplicate what we do. So on the national level, you have the American Veterinary Medical Association, but they tend not to delve down into state politics because, number one, the bandwidth issue to do 50 states is a lot for one organization, and number two, it's very difficult for them to know the legislators on a one-on-one basis and take that time to forge those relationships when they're all the way over in Washington, D.C., and we're here on this coast. So the CVMA is really largely a political representation organization. The part about that I find that a lot of people overlook is that we're not just talking about legislators at the state capitol. We're talking about the 18, count them, 18 government agencies that somehow regulate or oversee veterinary practice. The challenge with those is that a lot of them don't really understand veterinary practice, and they try to paint us with the brushstroke of human medical practice, which is different in many ways. And it really takes an organization being there to stand up and say, wait a minute, did you think about us? Or wait a minute, we're not quite the same in that regard. And so there's a whole lot of behind the scenes work that goes on that I think the veterinary profession doesn't ever really notice, because when we are successful in what we do, nothing changes for you. And so for those who just get up and come to work every day and things are the same, they might misconstrue that as thinking, well, the CVMA doesn't do very much because nothing's changing. Well, in fact, if we weren't here, you would have a very much different landscape, which, might lead us a bit into our next topic about Colorado. So, other things that we do, we definitely, we love to support upcoming veterinarians. So we have scholarships, we have programs like summer work experience programs for younger veterinarians. And we have a number of other programs that we run at the CVMA as well to serve the profession how it needs to be served. And that changes over time. I mean, over 137 years, we've had a dramatically varying role in what the profession needs.
Wonderful. And just out of curiosity, do you see that obviously CVMA has such a large presence in terms of politics and where things are heading for our profession? Do you see that being profoundly, like, do you see the political landscape, I guess, changing across the states to create different organizations for these state level, I guess, like politics? Yeah.
I do see that. It's a really good point that you make. You would never imagine that there's a tow truck drivers association, or that there's a guild of people that are interested in some really nuanced topic, but I assure you there probably is. And it's staggering the number of organizations that represent whatever interests they choose to represent. The challenge that I've found over the years is that there's really very little consideration of the size or the longevity of the organization. So, for instance, we represent 8,000 of the state's veterinarians. We have about 12,000, maybe 13,000 in the state. We represent 8,500. And then you can have an organization that represents maybe 33 people, and their voice is heard largely just like ours is, which I guess is important for the democratic process. But in a way, it also begs the question, you know, who are you really listening to as an expert in the field if, you have a newly formed group that just has a few people in it versus an organization that's been around, endured for 140 years and, really takes a lot of time to harness in all different areas of the profession, experts from all different fields, and really, have a dialogue on some of these topics. So there's definitely a gravitation towards, like, everyone's equal, everyone should be heard the same way. It's like, well, okay, I guess if that's the way you want to go. But I often think sometimes some of these organizations were constructed for the specific purpose of forwarding whatever cause it is they're wanting to forward. And then when that cause gets done, they're going to disappear.
Yes.
So for those reasons, I sometimes, wonder, what direction we're actually going in with politics. And is that a system that works very well?
Yeah. Oh, great. Well, moving into our next question is a good segue. We kind of touched upon the One Health approach and how we should approach that in veterinary medicine. So implementing that obviously requires a lot of different people with different perspectives, especially to stakeholders, right? So how do you manage the ethical and political challenges of balancing public health, animal welfare, and environmental protection?
Sure. And this is such a huge topic. I think that for me personally, as an advocate for the profession, I have to really listen, learn, and learn quickly about subjects that are sometimes tangential to my core body of knowledge. So here's an example. Perfect One Health example is fipronil. So fipronil is a topical spot-on parasite control medication that we commonly see as Frontliner Advantage. That's now essentially sold over the counter. It used to be only available through veterinarians, but now you can pick it up at PetSmart and Costco and all those places. Well, fipronil actually is causing some really devastating problems in our bay and our coastline. And it's resulting in an imbalance in not only the animal population on our coastline, but the plant and the flora population on our coastline. And it's pretty devastating, the imbalance. And so there's a move by environmental protection groups to ban fipronil. So fipronil, unfortunately, is not only used in our sector, but it's also used to spray on almond orchards. So now you're talking about the agriculture industry. And so you can see suddenly that there's a convergence of environmental specialists, agriculture people, us as medical specialists, all trying to, in the same room, represent our interests to determine how you make a path forward. And in order to do that, you really have to educate yourself on what are these other organizations' findings and what are their goals. I will say in the case of fipronil, the findings of the Environmental Protection Agency are very compelling and very obvious that we as a profession need to start to be aware that our modus operandi of spotting on these topicals may be becoming a thing of the past. We also have to recognize that fipronil and those topicals were a wonderful change for animals all over the state of California in helping combat flea and tick problems in animals. So it's just one example of how when you come to the One Health table, the pie is a lot bigger. There's a lot more slices, and you have to share it between a lot more people.
Yeah.
So having good communication, making sure that you're listening to them and understanding their point of view, and then also verifying the credibility of what they're saying, I think is paramount.
Yeah. Just kind of in a similar light, I think more of a national level. I know that there was that recent Senate Bill 1502, I believe, for the xylazine, the compounding. So that is also a really big issue because I think for veterinary professionals, we constantly use xylazine to treat and prescribe these medications to our patients that actually benefit from them. But when human medicine and FDA and everything gets involved, it gets really complicated, right?
Sure.
Yeah.
Well, spoiler alert, SB 1502, which was sponsored by the wonderful Senator Angela Gashby from the Sacramento area, actually was just reintroduced as SB 6.
Oh,
so
great.
It's now introduced for the 2025 year in the same form. And obviously is introduced very early, being SB 6. That means it's the 6th Senate bill to be introduced for the year. And that is an excellent example of when you're talking about a public health threat to people who are illicitly using it in combination with fentanyl versus the value that it gives us in the large animal world. There's a huge conversation that needs to be had there on the balance. I think that actually Senator Ashby has found the answer, and she's found that balance. And I really am appreciative of her staff and her listening to what our needs were, and understanding that while this drug presents a danger in general to the public, it also presents an incredible tool for safety, not only for the animals we use it on, but for us as veterinarians. Little known fact, I'm an equine veterinarian. I still practice. And I always tell them I really value the dental work that my parents paid to have done for me. And I don't want to lose my teeth to a horse that isn't properly sedated when I'm injecting its hocks. So xylazine is kind of instrumental in that action. So.
For sure. Yeah, no, there's lots of checks and balances, lots of things to think about, especially with so many people involved. So definitely great conversation. I think the next question that we want to talk about is another bill. It's definitely on the hot table now for the veterinary profession, but it is about Proposition 129. Yep. So it did pass by margin on the Colorado ballot this past election. So yep. What implications does it have for the future of veterinary profession in other states?
Sure. So one of the implications is the devil's in the details. So it started out as a bill number 145, which could not be found to be, the legislature in Colorado basically said this is beyond our capability of determining an answer to this. And so what happened with that is that bill actually became a ballot referendum. And that is Proposition 129. And I think that the implications of that for the veterinary world are profound, because that's the first time we've ever seen something so specific to veterinary medicine actually be decided on a ballot measure. And, traditionally when I think about ballot measures, I think of them as really broad topics, like something about, do we as a people want to spend money on a public transportation system, or do we want to do something with our tax dollars that will, reform our prison system? I feel like the concept of asking the people whether or not they wanted a mid-level practitioner in veterinary medicine is fairly myopic for a ballot measure, and to me, it erodes the spirit of what a ballot measure is supposed to do. Nonetheless, Colorado's constitution permits that, and that's what happened. I will say that I've seen many bills over the years, many ideas that just because they happen in another state doesn't make them a good one. And Colorado is actually one of my poster children for bad ideas. So whenever they point to Colorado and say, well, they did it in Colorado, my answer is, well, that isn't necessarily all that great. That doesn't mean that just because they did it somewhere else, it's the right idea. And so again, it comes back to critical thinking about, like, what is the bigger picture here? Which way do we want to go as a profession, and what problem are we trying to solve here? one of the things that you had mentioned about, the wonderful part about our profession is like the accessibility to all areas of the profession, and the fact that you can kind of be a chameleon and do anything you really want to do here. I think that when you talk about things like Proposition 129, you're starting to move us towards that pigeonholing that comes on the medical side of things, where you're stuck doing a certain specialty, with a certain residency in that, and that's your path, and there's not a lot of options outside of that. I would hate to lose that flavor and originality in the veterinary profession. I also feel like we are a very nimble profession in our ability to respond to things with animals. For instance, with a horse, I can do a mass removal, float its teeth, inject its hocks all in one appointment. So I'm an orthopedist, a soft tissue surgeon, and a dentist all at one time. In the human world, how long would it take you to have an oral medical procedure, a mass removed, and a joint injected? I would contend that would probably be upwards of 6 months or a year. So I appreciate the fact that we're a very nimble and responsive profession, and I really don't want to lose that over time. And so as an advocate for the profession, I always am trying to keep our sights on our sovereignty and our freedom, because I actually feel that ultimately serves consumers very well and helps our animal patients, who oftentimes are far sicker than we had otherwise known by the time they actually make it to see us.
Definitely. And I think that's a great segue to our last question, which is social justice. Theme of social justice, we kind of touch upon the accessibility of care, but also making sure that we are keeping the interested parties and thinking about all different aspects, right? So what are these crossovers that you've been currently seeing with social justice? I know that's a really big question,
but thank you. Such a question. Telemedicine is such an example of a crossover for social justice. So I personally believe that veterinary telemedicine, while there are some benefits to it, I actually feel like telemedicine law is a perfect example of institutionalized racism within our laws. So the concept of telemedicine is that if somebody can't afford to go see a veterinarian, they can't get their animal in because they don't have transportation, or their whiteboard falls apart behind them. The concept is that, well, we can hand these people telemedicine, and that's an example for them. So in looking at the glass half full, you could say, well, okay, it's better than nothing, right? It's if you can't afford to make it, you don't have a car, you don't have a way to get to a veterinarian, then telemedicine is an option for you. But I think that as veterinarians, we all understand that the quality of medicine that you will practice by telemedicine is inevitably lower than that which you would practice if the animal were in your presence.
Yes.
Because you're using 4 of your 5 senses to gather data from that animal in a physical exam versus maybe 1 or 2 of your senses if you're on a telemedicine appointment. So the quality of your diagnoses, the accuracy of your assessment, the advice that you give has a greater risk of being in error on telemedicine than if you're in person with the animal. So for those people who can't afford to see the veterinarian in person, we're handing them something that says, this is lower quality for you. We're spreading the butter thinner on the bread for you. And this is what you get. And I disagree with that. I feel like you're institutionalizing, by writing into law this lower standard, you're perpetuating a lower standard of care for those people who can't afford it in person. My feeling is we need to find a way to make it possible for them to be there in person. For instance, why don't we make public transit allow people to have animals on the bus, so that if they can't make it to us, they have a method to get there by public transport? Why are we not talking about something like that? So I worry about spreading the butter thinner on the bread, not only for us as veterinarians, because we have to be able to do our job according to how we've been trained, which is using our sight, smell, touch, hearing, hopefully not taste. Don't taste those patients. And also for the consumers who those animals deserve the same level of care as ones where their owner might be lucky enough to have a car. So again, it's a rabbit hole that goes pretty deep. And as an advocate for the profession, I have to spend a lot of time listening to people and hearing what they're saying. I do recognize that there's a place for telemedicine, but I also think about the long term as a society. Are we ascending or are we descending? as a society? And are we taking what's great about the veterinary profession and deconstructing it to the lowest common denominator? That's some of the things that go through my head as I look through a lot of these legislative bills.
No, absolutely. And I think also for the consumers who are participating in these telemedicine visits, probably maybe because of their situation, they might be underselling or maybe overselling their condition of their pets, right? Just to get that prescription medicine or just to get by, right? And it could add up. I could see for if there was a misdiagnosis and suddenly the dog or cat collapses and you have no idea what's going on, that will warrant an emergency visit, right? And
Sure.
lots of diagnostics involved. So
Sure.
definitely something to consider.
Yeah, well, we would hope that they would have the ability to do an emergency visit if something went wrong. But I'm not saying that there aren't times that telemedicine can hit the nail on the head. I think that there are. I just feel overall that as a profession, we need to be thinking about the bigger picture of not only what works for us, but what works for our clients. What would we want for that animal if it were our own animal? And so if telemedicine can work in that regard and you feel comfortable doing it, then I understand that and I'm supportive. But if there's times where you feel like you're on the edge of your seat because you're like, oh gosh, I just don't know, that's where I really want our profession to be educated on, the bigger picture of what we're doing here, and is this really helping, from a One Health perspective. So that's an example, at least one, of where the One Health type policy it's just a much bigger pie that you have to consider all these other aspects. So
you have a really tough job. Yeah,
I love my job. Every veterinarian has a tough job, but we love our jobs, and I feel like so much of it just involves recording the history of what's gone on and listening and understanding the topics in their totality. The legislators at the Capitol will be the first ones to tell you that they need to know a whole little about a whole lot. So they're really relying on people to kind of be their expertise when the rubber hits the road. And so they have a lot of legislation they have to deal with. They're very thoughtful people. They're highly intelligent, but let's face it, they're not going to be experts on all of this stuff. Somebody needs to be the expert. And that's where the CVMA really serves a vital purpose in the state of California, because it can't be duplicated by another organization, at least not one that I've found so far.
Absolutely. Well, thank you so much for your time.
Sure.
I think this conversation could have gone for many, many minutes and many, many hours, but we really appreciate your time here with us. Thank you so much.
Thanks so much for having me. Thanks so much for having me.